Welcome to Healing Horizons, Ibogaine Therapy in Mexico. I'm Chris Daniels, your host, and today we're exploring mindfulness and Ibogaine for veterans recovering from addiction and trauma. This episode is about practical tools, clinical safety, and purpose. We'll unpack how meditation can steady the body and mind before, during, and after a medically supervised Ibogaine experience, and why that pairing can accelerate healing. You'll also hear real-world stories and clear guidance on choosing a reputable clinic in Mexico. Whether you're a veteran, a family member, or a clinician, my aim is to offer grounded, actionable steps while honoring the cultural roots of Iboga. Most of all, I want you to leave with hope, clarity, and a roadmap for sustainable recovery. Thanks for being here today. Let's start with why we're focusing on veterans. Service members face elevated rates of PTSD, traumatic brain injury, chronic pain, and moral injury. Many juggle nightmares, hypervigilance, irritability, and isolation while managing complex medical regimens. Transitioning to civilian life often strips away camaraderie, structure, and a clear mission, increasing risk for alcohol or opioid misuse. Sleep disruption, blast exposure, and repeated stress cycles can sensitize the nervous system, making triggers feel relentless. Add to that survivors' guilt, grief, and the invisible wounds of ethical conflict, and recovery requires a precise, compassionate approach. Mindfulness offers skills for choice and pacing. Ibogaine, when medically supervised, may open a window for change. Together, they can reduce suffering, restore agency, and help reorient life toward values that matters deeply. So, what is Ibogaine? It's an alkaloid derived from Tabernanthe iboga, traditionally used within Bwiti spiritual practices. Clinically, Ibogaine may interrupt substance dependence by acutely reducing withdrawal and craving while catalyzing profound autobiographical processing. Emerging evidence suggests it modulates multiple neurotransmitter systems, resets certain receptor dynamics, and promotes neuroplasticity, creating a window where new learning sticks. People often describe a panoramic review of life events, patterns, and choices, which can support meaning-making and motivation. Importantly, Ibogaine is not a standalone cure. It's a catalyst that requires medical oversight and meticulous integration. When paired with mindfulness, the nervous system gets tools for regulation, attention, and compassion, transforming insights into daily habits. That combination improves retention and care, supports sobriety, and reinforces purpose. It also reduces shame spirals. Why Mexico? Ibogaine is not available through mainstream medical channels in the United States, but in Mexico, specialized clinics operate within a legal and clinical framework. That context allows for on-site physicians, cardiac monitoring, and longer preparatory and integration stays. Still, quality varies widely. Choose centers with licensed medical staff, clear medication protocols, and transparent emergency plans. Ask about continuous telemetry, on-site defibrillator, and an ICU transfer agreement. Equally important, approach the medicine ethically. Acknowledge Iboga's Bwiti roots. Ask how the clinic supports cultural respect and sustainability, and ensure informed consent is comprehensive and trauma-informed. Reputable programs won't rush you, won't overpromise, and will collaborate with your existing providers. If the answers feel vague, slow down and keep vetting. Your safety and dignity come first. Safety comes first. A rigorous medical screen should include a 12-lead ECG with QTC measurement, comprehensive metabolic panel, electrolytes, especially potassium and magnesium, liver function tests, CBC, and, when indicated, cardiac echocardiogram. A medication and substance history is essential, including supplements and antibiotics. During dosing, best practice is continuous cardiac telemetry, frequent vital checks, IV access, and on-site emergency readiness. Clinics should stratify risk, tailor dosing, and have physician oversight present throughout. Hydration, electrolyte optimization, and sleep stabilization beforehand reduce complications. Preoperative style fasting protocols and careful timing around last opioid or stimulant exposures are part of the plan. You should feel informed, not rushed, and have space to ask questions. If any of this is missing, reconsider proceeding. No protocol, no treatment. Choose safety. Every time. Let's name key contraindications. History of significant heart disease, arrhythmias, prolonged QT, uncontrolled hypertension, severe liver disease, or pregnancy signal high risk. Caution is required with QT prolonging medications, certain SSRIs and SNRIs, antipsychotics, stimulants, and methadone. Transitions from long-acting opioids must be medically planned, often tapering to short-acting agents, then managing a washout window under supervision. Do not attempt to self-manage or combine substances. Red flags in clinics include no ECG or labs, minimal monitoring, unclear medication protocols, no on-site physician, or vague emergency plans. Appropriate programs coordinate with your prescriber, provide written instructions, and check electrolytes before dosing. When safety is visible and explicit, you can relax, engage the process, and do the therapeutic work. That foundation reduces harm and boosts outcomes. Every time. Now, let's talk mindfulness, and specifically trauma-sensitive mindfulness. The principles are choice, pacing, and present moment orientation. That means practices are invitational, time-limited, and grounded in sensory experience rather than abstract visualization that could dissociate. Preparation begins weeks before treatment, clarifying intentions and values, identifying strengths, and setting a realistic daily practice of 2 to 10 minutes. We also create a somatic safety plan. Cues that say, "I'm okay right now," like feeling feet on the floor, noticing breath in the belly, or orienting to safe sounds. You'll map green, yellow, and red states and what helps each. Brief, consistent reps train the nervous system for regulation, so the Ibogaine process lands on steadier ground. We avoid pushing, forcing, or overriding protective signals. Respect builds tolerance. Here are practical techniques. Diaphragmatic breathing. Inhale through the nose, 4 counts. Exhale through the nose, 6 counts, for 2 to 5 minutes. Box breathing. 4-4-4-4. Brief body scans. Sweep attention through the body, pause where you detect ease. Orienting. Gently look around the room, name 3 safe objects. The 5-4-3-2-1 method. 5 sights, 4 sounds, 3 touches, 2 smells, 1 taste. Loving kindness. Phrases like, "May I be safe," "May my unit be safe." During the acute Ibogaine process, use simple anchors, a soft hand on heart, gentle breath counts, or a grounding object. No forcing long sits. Rest when needed. Ask the care team for trauma-informed support, reminders to sip water, and help tracking vital cues. Your job is safety, curiosity, and kindness. Nothing else. After dosing, many experience an afterglow marked by reduced craving, lighter mood, and openness to new behaviors. Weeks 2 through 8 appear especially plastic. An ideal time to install routines. Keep mindfulness brief and frequent. 2 to 5 minutes in the morning and evening. Add mindful walks, gratitude notes, and short journaling prompts like "What matters today?" or "What helped yesterday?" Spend time in nature. Sunlight anchors circadian rhythms and lifts mood. Translate insights into values-based action. Call a buddy, attend a meeting, prepare a meal, or schedule therapy. Stack habits on existing anchors. After brushing teeth, 1 minute of breath. After coffee, a quick check-in. Small wins compound, building confidence without overwhelming the nervous system. Integration coaching or groups can reinforce traction and accountability. Beautiful. When cravings or triggers arise, surf the urge. Name it, locate it in the body, breathe into and around it, and watch it crest and fade. Try RAIN. Recognize, allow, investigate, nurture. Use STOP. Stop, take a breath. Observe, proceed. For rapid downshift, use a physiological sigh. Inhale. Then, a small top-up inhale. Long, relaxed exhale. Repeat 3 times. Paced breathing. 4 to 6 or 4 to 7, 8 calms sympathetic arousal. Cold water face splash or holding a cool pack can reset intensity in the moment. For sleep, keep a consistent schedule, get morning light, avoid heavy screens late, and time caffeine before noon. Practice a gentle body scan in bed, and if restless, do a 5-minute sit in dim light. Protect bedtime, protect recovery. Small routines matter. Keep going. Recovery grows in community. Join veteran peer groups, MBSR or MBCT courses, and mutual help options like Smart Recovery. Involve family with clear boundaries and education. Work with trauma-informed therapists and prescribers who understand Ibogaine and veteran care. Never change medications without medical supervision. Measure progress simply. Weekly PCL5 or PHQ-9 snapshots, craving logs, sleep duration and consistency, and habit trackers that celebrate streaks. Create a personal crisis plan with early warning signs, preferred supports, step-by-step actions, and safe places. Share it with trusted contacts and your clinic. Keep key resources handy. Local emergency numbers and the Veterans Crisis Line. Dial 988, then press 1 in the US. Remember, asking for help is strength, not failure. Recovery is relational, consistent, and measured over time. Stay accountable. 2 brief stories. A Marine with alcohol dependence used breath counts during dosing and, afterward, a 2-minute morning sit. Cravings dropped, sleep improved, and he rejoined a hiking group, rebuilding community. An Army medic haunted by moral injury practiced loving kindness, first for a fallen comrade, then for himself. Post-Ibogaine, he set service goals, mentoring younger vets, which anchored purpose. Both tracked PCL5 and sleep. Seeing progress fueled momentum. Here's the takeaway. Mindfulness is the bridge that turns Ibogaine insights into durable, day-to-day recovery. Choose a medically supervised clinic, prepare with trauma-sensitive practices, use simple anchors during dosing, and lean into the afterglow to install habits. Keep supports close, honor Iboga's roots, and move toward what matters. You're not alone. Thank you for listening to Healing Horizons. Today,